We begin with many questions on the data being shared by the state related to the coronavirus. Lawmakers are seeking investigations, and media organizations like ours are working to find clarity for you. First, there were questions about the data medical examiners were releasing. Next, it was about outbreaks in nursing homes and long-term care facilities. Then, just this week, the removal of a top data manager with the Department of Health who says she was fired from her position after having concerns about data that was not being released to the public. 10 Investigates' Jennifer Titus has been analyzing that data for weeks and is here with why everyone should care about these numbers and the truth behind them.
It's this dashboard where many of you log on to see how many coronavirus cases have been in your neighborhood, how many deaths there have been. You expect it to be right. Well, the woman who designed this service was asked to resign. She says after questioning the state's transparency. Now lawmakers are asking for an investigation into her claims because of the importance and the accuracy of that information.
And we're going to continue to apply fact-based, data-driven approach to the problems that are before us.
It was a few weeks ago when our governor praised the numbers as to why he decided it was time to reopen the state. That data can be found here on this dashboard. It's something we all use to monitor the situation. But in this May 15th email, Rebekah Jones, who designed that program, wrote to a group whom she regularly sent coronavirus data to these words: "For reasons beyond my division's control, as of late in the day on May 5th, my office is no longer managing the COVID-19 dashboard. I am no longer involved in the publication of data, fixing errors, answering questions, etc. in any shape or form." She goes on to say that her commitment and transparency is one of the reasons she's no longer running it. Days later, she was asked to resign from her management position at the Department of Health.
This is dangerous. At the best case scenario, this is a deceptive cover-up. But the worst case scenario is that this is really a public health crisis.
Agricultural Commissioner Nikki Fried is just one of the many leaders on the state and federal level asking for an investigation into why Jones was removed from her position.
It's important to get to the bottom of it because we need the accurate information. And that's really what is so at the heart of all of this.
Because that accurate information is what you are making decisions based upon your own safety and if you're ready to head to the beach or eat out at restaurants.
How can we make those judgment calls if we're not getting the right information?
Commissioner Fried says the data being released by the state must be accurate. She says it's crucial and really a matter of life and death.
Our number one economic driver up until this point is tourism. And if we are seeing that, we are not giving out the correct information and that there's something just fishy going on here in the state of Florida, people aren't going to come back here.
Today, Governor DeSantis spoke more on the removal of Jones from her position.
She is not involved in collating any data. She does not have the expertise to do that. She is not an epidemiologist. She is not the chief architect of our web portal. That is another false statement. And what she was doing was she was putting data on the portal which the scientists didn't believe was valid data. So she didn't listen to the people who were her superiors. She had many people above her in the chain of command. And so she was dismissed because of that.
By the governor's own comments, right there, we know that data in the dashboard has been incorrect. So when was it inaccurate? For how long? And is it fixed yet? Those are questions we've been asking and why transparency is key. Commissioner Nikki Fried has asked for members of the Department of Health to come forward at next Thursday's cabinet meeting so it can ask questions about Rebekah Jones. If they chose not to appear, the health department is solely under the purview of the governor. State Senator Javier Rodriguez sent a letter asking for the Inspector General to look into the matter. That's also an agency that reports to the governor. Fried says it will be up to the governor to do the right thing and have his employees appear in front of the cabinet.
We've reached out numerous times to Rebekah Jones. She hasn't returned our calls. The governor's office is also calling for an investigation into why Jones had a job in the first place after facing sexual harassment charges. 10 Investigates confirmed prior incidents regarding Jones. You can hear more about what the governor said at WTSP.com/10Investigates. We're going to continue to bring you the facts, not fear, on this story, because that dashboard is key to determining how and when we reopen our state. It's so important to get those numbers right. In order to move forward into phase 2, we need to see the number of cases decrease continuously for 2 weeks from the start of phase 1. And after a big spike over the weekend, the number of new cases has generally gone down. But as you can see, since April 20th, it's kind of been all over the place. Right now, the state is reporting 47,471 cases, 2,096 people have died. But only about 6% of the number of people actually getting tested. That's a good sign as we move forward with reopening.